much. All right, well, good afternoon. I'm Ruth Trimarchi, Chair of the Winchester Board of Health. It's June 6, 2022, and I call this regularly scheduled meeting to order. This meeting is being recorded. Roll call vote for attendance. Maureen Pimentel.
Here.
Greg Sawicki.
Here.
And Ruth Trimarchi is here. Greg, do you want to go over the agenda for today?
Sure.
Thank you.
Thank you again for sending it and putting it in advance, but our agenda today will include again, outside presenter, Maureen Busby from the Regional Tobacco Prevention Program will be providing some information about tobacco control policies from the state perspective that we'll be considering as a board. Then we'll have some public comment if needed. We'll continue conversation of our Board of Health goals. We'll start a discussion around mental health concerns as related to the role of the Board of Health and the Health Department. Then we'll have updates from Jen Murphy, our director, and then we'll review any necessary COVID updates and approve old minutes.
Thank you. So I'd like to, without further ado, then welcome Maureen Busby. She is the Regional Tobacco Prevention Program Coordinator. And Maureen is going to update us regarding the recent changes in Massachusetts state tobacco regulations. There is a possibility that the Board of Health may need to vote at a future meeting to bring Winchester in alignment with the new state regulations. Welcome, Ms. Busby.
Let me unmute myself. Thank you so much. I'll try to kind of fly through the changes, and I will offer to send my notes to Jen so she can share them with all of you. So please don't feel you need to take notes. It's a lot to go through. So first of all, my goal is to familiarize you with the new state tobacco law. It's called an Act to Modernize Tobacco Control, part of which became effective 1/1/20 and parts of which were effective 6/1/20. I'll be focusing on the provisions of the law that relate to tobacco sales and point out where Winchester already matches or exceeds state law and where the board may want to consider adopting changes to your local tobacco regulations so that they are in sync with state law. State law trumps local regs, so wherever state law is more restrictive than the local regs, will enforce the state law anyway. But it's easier for retailers if state and local regs match. The law is robust and it has provisions that relate to smoking cessation benefits, the state's tobacco program budget, and other areas. Again, I'll focus tonight on the provisions that relate to tobacco sales enforcement. So first of all, the flavored vape product ban was effective 1/1/20. No flavored vapes of any kind, not nicotine, CBD, or any other substance, with just two exceptions. Licensed facilities such as medical marijuana dispensaries and recreational pot shops can sell flavored vape THC products. And adult-only smoking bars can sell flavored tobacco products for on-premises use only. And Winchester doesn't have any smoking bars. Some years back, Winchester restricted the sale of flavored tobacco products, but those earlier regulations used the federal definition of flavored tobacco, which exempts mint and menthol. So lots of menthol cigarettes were still in our local stores, along with wintergreen and spearmint chewing tobacco, and of course, mint and menthol jewel pods. Another major change in the law was that fines were increased from $100, $200, and $300 to $1,000, $2,000, and $5,000. And the tolling period, which is kind of like a probation period, once a store has a violation, increased to 36 months statewide. Several Massachusetts communities, including Winchester, were already at 36 months. So that part is no change to you. But I do want to explain how that works because it's going to affect something else that we will discuss tonight. Think about the tolling period as a look-back period. If a store violates a tobacco law, we look back 3 years to determine if it's a first, second, or third violation in that 3-year period. That determines if the fine will be $1,000, $2,000, or $5,000. It also determines the length of the permit suspension. There was no suspension for the first violation, and that's still true with one exception. If it's a sale to a minor under the new law, there is a suspension requirement. 7 days for a second violation and 30 days for third violation within that 3-year tolling period. State excise taxes were imposed on all e-cigarettes for the first time, which means a Department of Revenue license is now required for vape products so that excise taxes can be collected. So a retailer may now need up to 3 DOR licenses, one for cigarettes, one for cigars, and one for e-cigarettes. This is something that I check and then I report to Jen, and there would be violations that would be counted towards the fines that we'll discuss and the permit suspension. There's also a lot of new signage. A store may be required to post up to 9 different signs. Again, that's something that I just check and let Jen know. All customers must be ID'd under the new law. It used to be that we'd tell retailers that anybody who looked like they were under the age of 27 had to be ID'd. But under the new law, every tobacco purchaser has to be ID'd, no matter how old they might look to the clerk. Again, all sales to minors, all sale to minor violations trigger a suspension of the local Board of Health tobacco permit, even if it's a first offense. This new first violation suspension has an additional wrinkle. Instead of the specific number of days that we're used to, 7 days for a second violation and 30 days for a third violation, with this first violation, if it's a sales to a minor, the violations or permit suspension period is determined by the Board of Health. So something we may want to talk about and you may want to vote on at a subsequent meeting is to determine a set number of days for that first violation. So similar to a second and third, say 3 days or 5 days or any number of days. Since a second violation triggers 7 days and a third violation triggers 30 days, you might want to consider something less than 7 days. So it goes along, it's a first violation, like the fines are less for first violation, you may want the suspension period to be less. But if you do vote to adopt a specific number of days, that will avoid having to meet every time there's a sale to a minor and determining in each if it's a first violation, and determining in each instance what that number of days will be. Also, it's easier to educate the retailers. And right now I'm saying to them, oh, and for a first violation, a $1,000 fine, and also suspension if it's a sale to a minor, and it's 1 to 30 days to be determined by the Board of Health. So that's not great for the retailers. It's much better if there is something firm that we can tell them when we're explaining what these regulations are and what the penalties are if they violate. Other requirements under the new law, a so-called manufacturer's letter is required for all nicotine products, attesting to the absence of flavored ingredients. So no flavors are allowed in Massachusetts. For every product that a retailer sells, they have to have a letter from that manufacturer saying there are no flavor ingredients in that product. They also, for those who sell vape products, a manufacturer's letter is required for all vape products indicating the nicotine content. Under the new state law, they're family-friendly stores, so not adult-only stores, which you don't have anyway, but all your stores in Winchester are family-friendly. But those stores are restricted to selling vape products that have no more than 3% nicotine content or no more than 35 milligrams per milliliter. And for stores that sell vape products, they have to have a manufacturer's letter attesting to that. Underage buyers cannot be fined. We didn't do this anyway, but the new law makes it clear that the penalty for a sale to minor violation is assessed to the seller, not to the purchaser. And unlike alcohol, it is not illegal for a minor to be in possession of a tobacco product. Also, a store cannot advertise products that are prohibited. So for instance, no more menthol cigarettes, so you can't have those big green Newport menthol signs in any store. Other older provisions of the state laws, state and local law still apply. Local Board of Health permit is required to sell tobacco products. No sales in pharmacies or educational institutions. No coupon redemption No out-of-package sales. Humidors and other self-service displays must be locked or out of reach of the customer. Liquid nicotine containers must be child safe. Cigar minimum price, permit cap, proximity ban, and ETS regs, environmental tobacco smoke regs, still apply. Obviously, we've done a lot of retailer education, many points of contact, including in-store visits, as well as mailed materials. In the case of a violation, a store owner has a right to an appeal. Appeals may be made to the local Board of Health. Board members will hear testimony from the retailer and from the enforcing officer, which in most cases would be me, and decide if in fact a sale took place and that proper protocols were followed. So if there is an appeal from a retailer, you're deciding, one, did a sale take place? And then two, were proper protocols followed? All our youth are trained, so if a store clerk says, if you don't have an ID, I can't sell to you, they can't say, oh, just this one time I left my ID in the car, it's for my mother, or anything like that. The transaction is over the minute the clerk asks for an ID. Because the new fines exceed what we call the 21D ticket or civil fine limit of $300, if a retailer wishes to appeal the amount of the fine, that appeal needs to be made in a state court, not with the Board of Health. It's a state fine, and it has to be appealed in a state court. Just as an aside for you, not that we will discuss this in detail tonight, but I do want to mention, since you're all on the call, we are seeing a lot of new products. In addition to the endless variety of new e-cigarettes products, we're seeing a lot of Delta 8 vapes. That's a CBD product that can be vaped. We can enforce flavored CBD vapes under the law because there was no exemption granted, but unflavored CBD vapes are allowed, at least for now. There are a lot of other CBD products, creams, balms, tinctures, gummies, and other candy type products, even honey CBD straws. It's the responsibility of another agency, MDAR, Mass Department of Agricultural Resources, to enforce CBD regulations, but it appears that they just don't have the feet on the ground to be in every retail outlet that carries CBD products, and many stores do, including stores like Whole Foods and Macy's and so on. That said, I do think, and I share information with Jen from time to time, we need to keep an eye on Delta 8 and other newer products. I recently shared a CDC Delta 8 advisory with Jen that was just an advisory saying, we have seen situations of some health consequences for people who've used Delta 8. It's not a regulation, but again, it reminds us it's something we want to pay attention to. Kratom has exploded. I used to see it in small amounts every now and then, and mostly in vape shops. Now I'm seeing it in bigger quantity or larger quantities in different kinds of products and in family-friendly stores. Not just the powder, there are pills, capsules, as well as liquid kratom shots, kratom chews, kratom soda. And I bring this up not because it's a tobacco product and it doesn't fall under tobacco regulations. It's just meant to inform you that we're seeing these unusual products in greater quantities. So to wrap up, I think that you probably have three major considerations. One, do you want to update local regs so that they line up with new state law? If you do, I can ask a Mass Tobacco Cessation Program TA, a technical advisor, to draft new regs for you, and that will highlight any changes that we're making suggesting to the regs that you already have in place. So that's one of just updating the regs. And do you want to update the minimum cigar price? That's a local regulation, not state law. And some years ago, Winchester Board of Health adopted a regulation that required cigars to have a minimum price. So any single cigar in Winchester has to have a minimum price of $2.50 plus sales tax, and any multi-pack, 2, 3, 4, it doesn't matter. Any multi-pack has to have a minimum price of $5 plus sales tax. Written into those regulations some years ago was a clause that allows for price increases over time based on CPI or some other relevant index. Some of our municipalities recently adopted a $2.90 minimum for singles and a $5.80 minimum for multi-packs. So something else that you may want to consider. Also, if you adopt the new state regs, and because state law trumps local regs, you will have two different sets of fines. You'll have 1,000, 2,000, 5,000 for any state law, whether you adopt the regs or not. And then you will also have 100, 200, 300 for any local regulations. And a local regulation that you have is the one that I just mentioned about the cigar minimum price. So some municipalities have decided that we'll just have one fine structure. We'll make it 1,000, 2,000, 5,000 for all fines. So you can either go with a dual fine structure, or you can make those cigar minimum and any other local violation equal to the state law fine. And then if you do adopt changes, we'll need to have an effective date for those changes so that education of all our retailers can be adequately carried out. So any questions?
Thank you so much. And yes, go ahead, Dr. Sawicki.
Thanks, Maureen, for that update and summary. I just have a quick question actually for Jen first. You sent us the most recent regulations that were adopted. I'm just because they were sent right before the meeting, I haven't looked through them all, but they were last adopted in, it looks like in 2020, is that correct?
Yes, February 2020, but they took effect June 1st of 2020.
Okay, and so I think that, I'll just say that I think it is appropriate for us to, in light of the new state regulations and rules, to think about where we may have discrepancies or differences, because I think it would make sense for us to be updating and adopting regulations that are current in line with the state. And I'll just make a comment that, as a pulmonologist, this is obviously a very important issue for me in terms of public health promotion. And I recognize that Massachusetts as a state has been far ahead of many other states in the country in terms of many things, in terms of regulation of sales, in particular, the ban of flavored vape products. There are many states, both in the region and then nationally, that have not gone that direction. And it's something that we have seen a lot of. And in fact, in my sort of day job professionally, we work with a vaping clinic at Boston Children's Hospital, and we've seen the effects and the ill health effects in kids and teenagers of using flavored vape products in the past, and they still can cross state lines and often get them. And so I think making sure that we as a town are endorsing these vigorous guidelines, I think is really a great statement for us as a Board of Health. So I think, my recommendation would be that we do look at where we may need to update our regulations and work with you to make sure that we're up to date.
Thank you, Dr. Sawicki. Ms. Pimentel?
Thanks for that presentation and all the work you've been doing. I just had one question, and I don't know if you know the answer to this, but why didn't they restrict the use of flavored vapes in dispensaries?
So it was a tobacco regulation, tobacco law, and they didn't have that regulation wouldn't be a tobacco law, it would be a cannabis law. Okay. So if you can vape cannabis under the cannabis law, so, and I guess, they didn't tackle flavored. So this is strictly a tobacco law.
Okay, that was just a question because it seems like a large area where you could then just stream flavored products through. Okay, right. Thank you very much. I appreciate it. And I agree. I think we should update our guidance to fall in line with the state.
As do I. So is it appropriate then, Ms. Busby, at this time to ask you to look at a technical advisor taking that step for us and getting back to us through Jen or Jen, do you want to suggest what the next step should be?
Yeah, no, and that's the next step. So I can work with Maureen to tee up some draft regulations. I think I like Maureen's 3 suggestions, certainly using the TA to assist us in doing that, but also the cigar sales increase. The last time we increased it was 2020, and that was with the $2.50 and the $5 for the cigar sales points. So we may want to consider upgrading or increasing those price points, and I will include that in the draft. And then the fines, the issue becomes, do we keep our own and also have this? I mean, the states we have to have and include in our reg, but do we also want to have our own? And I think to keep it clean and to streamline it, that's what I would suggest. So that's how I'll tee it up, and then you can save that for a discussion later on, unless you feel strongly right now that you don't want any of those suggested items from that Maureen recommended. Otherwise, I will draft it as Maureen suggested, because I do agree with those.
Yeah, Jen, I think that makes a lot of sense. And I think the only other question I have is if there are any areas, and in reviewing the regulations where we think we need to make any edits, it would be an opportunity to do so. So if you have any thoughts, you should certainly share them with us as well.
Yep. And I'll work through that, because I know Maureen also has great ideas to do that, as she is the one in and around the retail stores. So any areas where you think, Maureen, additional tweaking is necessary to further restrict would be good. I also want to remind you, in our current regs, which I think is excellent, we had an 8 permit limit. 8 retailers could only operate in our town, but we also have a permanent retirement provision. So once someone gives up their permit, does not renew for 1 year, that permit is permanently retired. So currently that we are down to 7 permits, and all 7 are being utilized. So if we had someone new try to apply in town, they could not. And so if we have a retailer give one up in another year, then that allowable number of permits will decrease to 6, and so on. So I think that's a really, really great provision we have in our regs that I would like to, I don't suggest changing that at all, but I wanted to remind folks it's in there.
And Jen, just like again, have there been, just so that I understand, have there been violations in the last 5 or so years? I mean, are we dealing with a significant number of violations, very few?
So unfortunately, during 21 last year, and this could just be a reflection of COVID and how crazy things were, there were 3 retailers that actually had violations under the new hefty penalties. So unfortunately, 3 retailers had to pay $1,000 each. So, but prior to that, they were very, very few and far between, thankfully. Correct, Maureen? Is there anything you wanted to add?
That's absolutely. Winchester has been very compliant. I would like to point out, or just, mention this. If you decide to update your regs, so you're just basically doing an update, you're not adding anything, you're gonna update the cigar minimum price, whatever, then that you may want to, but you wouldn't certainly be required to have a public hearing. If you decided to make some real wholesale change, like let's just say ban CBD products, which I'm not recommending, but ban CBD products, and that would be a big change, and you would probably want to do a public hearing, correct, Jen? If it's been your history, whenever there's a big change, to have a public hearing, then you would want to do a public hearing. So what I've kind of encouraged towns to do is to update the local regs and get that done and get all the education done, and then maybe tackle some of these other issues that we're starting to see emerging products. So it is, if just for your consideration, because there are new products that I'm concerned about, and I will continue to share, but you might want to separate the 2 actions.
So you mean, for example, Maureen, the Delta 8 and the Kratom sort of explosion you've been noting, we do some maybe public health education, some communication around that, separate outside of the regulation.
Right.
Yeah.
Yep.
That's how
we've
handled it historically.
Exactly. Yep.
That sounds good. And thank you again. We look forward to having you back soon. If there's no further questions from Ms. Busby from the board or from Jen, we can close this portion of the agenda. Is there anything more that anyone wants to raise their hand and ask? Well, I'll just ask, what are we looking at for a timeline? What effective date might you be thinking about?
So if I could just offer what some other communities have done, 2 or 3 months, and then that gives the board a chance to send a letter to the retailer saying changes were adopted, these are the changes, and then it gives me a chance to go out and talk to all the retailers and meet with them in person, and then it gives them a chance to increase their cigar prices, for instance. But yeah, 2 to 3 months.
And is that enough time to work with the TA as well? Do we know their availability?
Yeah, thank you for asking that, and they would appreciate you asking that, Jen. But yeah, because they have model regs, they can the turnaround has been pretty quick. Although DJ Wilson is retiring at the end of the month, so we're going to lose we'll lose a fabulous resource. So I'm glad that Winchester's going to work on this right away before DJ leaves. But Cheryl Savara is still there, Winchester person. And so one of them will very quickly draft those regs and get them to you, because we'll just be superimposing the new state language onto the regulation you already have. And it'll be highlighted in such a way that it'll be easier for the board members to look to see what's just adopting state language, for instance, the new flavor definition, and what is actually more of a change to your local regs.
Can I ask, when other towns have adopted the new regs or included the language, do they also include the section regarding the appeal to Superior Court? Because that was a real, it's been a real sticking point. People don't understand that they can't appeal to the local Board of Health for the fine reduction. So
yeah, the language, it is, oh, let me see if it's in there. I think it says appropriate court.
Oh, okay.
It doesn't name the court.
As long as it says court.
Yeah, it says appropriate court. I think there's a reluctance to give legal advice, so they put appropriate court.
Yep, no, that's good. Thank you.
Okay, go ahead.
Thank you all so much. I appreciate you taking the time to go, sit through all of this, and for your consideration as you look at the new draft.
Thank you so much, Maureen, for your help.
Thank you. We'll be talking.
Ms.
Okay.
Bye.
Take care.
Bye-bye.
Bye. All right, so we will leave that in your good hands for the next step, Jen. Thank you. Gina, is anyone present for public comment today?
There are guests on, yes.
Okay, so let's just note that the Board of Health welcomes members of the public. I'd like to remind everyone that the purpose of public comment is to permit members of the public to express their opinions on matters within the purview of the Board of Health. It's not a dialogue, and the board is under no obligation to respond to comments or questions. We request that speakers are respectful of board members, staff, and the public, and that comments are directed at policies and actions. Please refrain from personal comments about any individuals. Speakers are asked to state your name and full address. Comments are limited to 2 minutes per person and 1 comment per meeting. The total amount of time for public input is limited to 10 minutes. With that, let's go ahead and listen to the public today.
You could raise a hand. No hands raised.
All right, very good. Well, then we will close public comment. And moving on to the third item, which is a consideration of Board of Health goals. I did circulate to my colleagues here some recommendation, well, not recommendations, just points of discussion following our last meeting, when it was requested by Ms. Pimentel that we consider, rightfully so, putting a little more teeth, a little more directives and benchmarks and deliverables into the general categories of goals. And Dr. Sawicki recommended that we have a point person as much as possible for each one. So thinking about what, I will say that when I circulated the most recent document to you, I don't know, last week sometime, I realized in looking it over that there's some redundancy, and we could probably, even if you like some of the suggestions that I made, they can certainly be streamlined, because there is redundancy from one section to another, for which I apologize, but I did my best. With that, let me toss it open to my colleagues for discussion. And if you feel the need, we can put that up, or we can just verbally take a look at it.
Ruth, if you want to put it up, if it's easy, that's fine. My question was, is this and this is a procedural question, is this a document that needs a vote, or is this a document that we can just consider a working draft document that sort of is a working document among the board members to just keep everything? Because I would say, most goals documents for organizations and groups, tend to sort of be a little bit fluid in that,
Mhm.
certain goals are met or projects take precedence, and as opposed to sort of codifying it, like we have to, I
Mhm.
wouldn't want to feel like we need to be voting on adding something or taking something away. It's more to me like, is this just an internal working document that we, can work with and Jen and the health department to just sort of know that we're sort of all on the same page versus it being like it's not a policy statement. It really is, it's more to me like a working document. So unless I'm mistaken, I guess, we can discuss it, but I'm not sure that it requires there to be sort of it's sort of codified through votes. But that's, I'll let you or Jen or Maureen comment on what you think.
I agree with you, and you did mention that last time, and I do not see a need for a vote on it, but we'll certainly want to hear what Ms. Pimentel thinks. I think that we want to be very flexible in that over the course of the year. I'll also note that it's never been done by the Board of Health before, so this is new territory for us, and we can take care of it in any way we see fit, pretty much. Ms. Pimentel, are you all right with considering this a discussion, a general agreement, and not having a formal vote taken on goals?
Yeah, I agree. I think, as priorities shift and as things come at us, I think that goals can shift, and I agree, it probably should just be a working document or a framework of the things that we think are the most important things for the board to work on.
Okay. I'm not saying that I have there's the share. Okay, let's see what we have here. Let's just pop these up and just run over them, I guess. I'm not sure if we really need to, but it doesn't hurt. Let's see here. Can you see this document here?
Yep.
Okay, great. And this is one with the redundancies iterated. So we looked at a handful of goals when we last met, four groups of goals, and everybody has seemed comfortable with keeping these as our general goals going forward. Certainly one is to support all of the health department goals, and they covered a wide range, as we know, from COVID, mental health, climate change, tobacco and vaping, vaccination programs, et cetera. In terms of a point person, it seemed like for COVID, we would want not a point person, but all of us. And some measurables might be to consider updating our own webpage. We do communicate our data sources at every time whenever we discuss those at a meeting. We're very clear on what we're putting up, if it's wastewater, whether it's the school's data, et cetera. On the health department webpage, they have a listing of helpful links for COVID data, and we could consider putting that up with something we could put as a goal. We don't have to do it. We certainly want to keep messaging high, since we know that COVID is going to be with us for a long time, and we don't know what twists and turns it's going to take. The third thing I propose for some kind of a measurable is to consider some kind of metric. People have asked for that repeatedly, and we have always said that there is no single metric, nor is there a conglomerate of metrics which should trigger automatically a response, any given response, whether that's a mask mandate or a requirement for proof of vaccination or any such thing. And I would, in my own opinion, I still feel that that's appropriate, that we cannot have a single metric nor an array of metrics which automatically triggers a response. What I'm proposing here is that we could consider some metrics which would trigger a focused discussion by the Board of Health with the possibility of some action after that or not. But that in the effort to make the public, we try to be as transparent as we can. I'm simply saying that we could consider doing that. And again, I don't want to commit us to anything. Let's stop there and see what my colleagues think about those two pieces here. First of all, is there either of you, do you want to volunteer to be a point person on COVID, And are you roughly in agreement that those are some measurables we could aim for during the course of the year? Ms. Pimentel, what are your thoughts on that? Do you have anything you'd like to offer at this point in time on that?
No, I think that all of us being engaged is probably the right thing. I think that, as I've seen on my time over here, the metrics are difficult to identify what would trigger something. So I agree, just a continued focus to be looking at the data and making the best decisions for the town. And then the only other thing I would say with COVID is just ensuring adequate funding for any vaccination clinics, testing clinics, or anything else that the health department would need to continue to have a robust response should we need it in the future.
Thank you.
Yeah, I totally agree with the sort of as a benchmark being, advocating for appropriate funding for health department efforts. I mean, maybe we leave it something broad like that.
Could you say that wording again?
Advocating for appropriate resources for health department. What did I just say? I already forgot.
Yeah, we'll leave it at that, and we can.
But I would also, and I would just add, I see on the mental health measurable or benchmark as a dialogue with select board and school committee. I actually think that, and we've talked about this before, we have been in, and Jen has been engaging with the schools, but I think that we should put in our goals around COVID to have a focused discussion with the school committee in terms of thinking about any issues and concerns that may be necessary for the next school year.
Thank you. Yeah, I'm in agreement with that.
But I agree that this is all hands on deck. This is exactly the biggest public health issue right now, and so I think we just need to continue sort of all being involved.
Okay, and so when we get done with this, I will circulate the updated document, and I think we can move on to mental health with that. In this area here, I simply realized afterwards that there was a lot of repetition in here, and I might suggest that instead of meet with state reps, that we consider at some point in perhaps this summer or soon, sending a letter from the Board of Health to the various state reps calling for more funding for mental health training programs. So to Jason Lewis, Mike Day, and Pat Jalen, our state reps. And of course, they are all well on board with us about this, but we're all well aware that when a representative or senator has documents in hand and hears from constituents, it gives them additional leverage to go forward and fight the good fight for us. The others there are redundant with things that we've said before. Oh, on number 4 here, let me say on mental health, it says possibly meet with the hospital president. We don't need to restrict ourselves to the president, but just to meet with the hospital. And I will say that there was a very good outcome from Town Day at the table where I was working. The Board of Health, the Health Department had a tick table immediately adjacent to the Leahy Clinic table. And someone there spoke with me. She's an outreach engagement person, and she's interested in working with Winchester in terms of expanding youth programming and offering grants where potentially applicable for us. And so she and I agreed to pick up that conversation very soon. So we would just say, possibly meet with the hospital regarding collaborative programs they might be able to fund. And then I would delete 2 and 3, or yeah, anyhow. So we need a point person on mental health, I think, or we could have all of us do that. My preference would be to have a point person that's not me and to support that person in the ways that I'm iterating here. If I'm in dialogue with this person at the hospital, that, send that information in the direction of the point person. Having said that, I'll toss the discussion open to my colleagues.
I'm happy to serve that role, but I'm also happy to share it. I think, again, this is a big issue. There's a lot of things here. This was obviously something that's come up a lot. We've heard it from town's residents, from other leaders in the town. So I think, again, this is probably another, there are sort of issues. I mean, the coalition's doing so much work already. And so we're already engaged with them. And so I think, again, I'm happy to sort of play that role. I'm happy to share it with Maureen. I'm happy to have it be all of us.
Mhm. We may
I-
want to think about it in terms of age groups. Maureen, your thoughts?
I agree, and it could be that it's all, and then just specific parts of it, if, say we're gonna try to go after some funding, or say we're gonna try to set up some webinars, say we're gonna try and, whatever comes out of these discussions, whatever actions come out, maybe at that point we can have point persons for those
Mm.
types of things in my mind. But I think that the ongoing conversation and the needs in the town and how to best serve the town is probably, all of us should be engaged in that.
I agree. I agree.
But obviously, I, have a fair amount of history working
Yeah.
with youth and mental health issues, so happy to
Right.
help in any way.
Great, great. Thank you so much. And with that, I'm going to delete this 3, which is truly a repetition. And let's, how about we change meet to just converse? And that could leave open any kind of a letter or any type of communications we might want to undertake in the future. And I'm going to, delete the, I'm sorry, with the hospital. My apologies, like that. Okay, with that, unless someone jumps in to say more, we'll move on to climate change. I've proposed that I would be a point person on that, given that I've led 3 climate committees here in town and led the team of 18 people that wrote the climate action plan. But I'm certainly, there are many health issues that overlap with climate, so I'm happy to share the responsibility in any way.
Ruth, I support you being the point person here for sure, given your history.
Yeah, that's great.
Okay, thank you. Things that we could look at, we've already endorsed the heat strategy that our sustainability director, Ken Pruitt, brought to us a couple of meetings ago. What I'm saying with the word implement here is that as he brings those issues forward where it's appropriate, when the climate change and the health issues overlap, we work together and collaborate with that department. The leaf blowers, Quiet Clean Winchester, came to us last meeting, and they are working their way through a multitude of committees and boards, and are aiming to bring an proposed amendment to town meeting in the fall, and we agreed that we may support them depending on the specific language that they bring forward. We haven't talked much about the trees committee. I will update you from time to time on that. Again, that may possibly go to an article to be brought forward in fall town meeting. The trees committee has been meeting for 2.5 years, 2 years now, a collaboration between the planning board, the conservation commission, and the climate action advisory committee. And I am that rep from climate action. It is largely the goal of the committee is to protect the tree canopy in Winchester. And there's a number of strategies. Most important is public education. So I'll continue, I'll make some kind of a presentation, or someone from that committee would, as we move through towards early fall, probably. TIC program, Jen and Jessica Pfefferman, and I think those are the 2 main people, have been working on this for years. And so there was a town day table with Paul Killinger from UMass, who I was very impressed with this weekend. He had a wonderful display. We got a lot of traffic. I will say town day, for anyone who wasn't there, was very well attended. In my opinion, it was a really great in-person event this weekend. And there was a lot of traffic by the trees table. I will say, I never stopped talking when I was working that one. And quite a lot of traffic as well by the Leahy Clinic. They had wonderful free giveaways. And the TIC program was of great interest, especially to parents and young kids. On green infrastructure, our sustainability director is working on municipal vulnerabilities preparedness grant. And I think that there are opportunities for us to be supportive and have an educational component around what green infrastructure is. Are there questions on that, or we'll simply continue on with climate change as we are doing? Okay, not seeing any. We sort of took all the rest of the health department goals and just said everything else, all routine work. And what I'm saying here is that all of us should be the point persons on that. The coalition has been doing a great job on bringing in speakers, and the array, the diversity of topics and so on. I don't think we can improve, but we can all support the coalition by bringing forward potential speakers, or when a webinar or something is arranged for by the coalition, I think we as Board of Health members can help to promote those events. And maybe there will be opportunities for additional kinds of speakers or programming or other venues, can't predict. In the absence of seeing my colleagues and raise their hands in terms of efficiency, we'll go on to goal number 2. Develop a robust Board of Health webpage to encourage communication, engagement, and transparency. I could offer to be the point person for handling incoming content and working with Gina and others to get that posted, if you would like. When we first started in March with Dr. Sawicki, myself, and Maureen, and prior to that point, the Board of Health webpage is the bare minimum. It's our charge, and it's the names of the people on the board. The health department has a robust webpage that I know Ms. Murphy is still working on to tweak a little bit, but that one, we want the 2 documents to talk to each other and to form a loop. So knowing that sometimes people get mixed up between the Board of Health and the health department, we certainly want, if someone lands on the Board of Health page, to reference back and loop them back to the health department. So that would be a link. There's a handful of other straightforward and easy things that other boards and committees do have links to minutes, for instance, and links to the charge and so on. So the idea, what I'm proposing here is that my colleagues work with me on developing content over the course of the year as you see fit, funnel it through all of us for consideration, and from that point go to Gina or whoever to update and build the web page over time. Comments from my colleagues?
That sounds fine. I think who is in charge of updating the website? Is that internal, or is that someone else in town?
It's a great question, because we do not want to tie us into pieces that need continuous updating. You know, that is a big job for Ms. Murphy regarding the health department and continuously updating, for instance, COVID data. And pretty much, I'm not talking about that level of update. If you just, in terms of updating it, we just send either to someone in the town manager's office, usually Jen Caffarella, or Gina or Jen, or I think all of those people can actually just update it, put new material on. Does that answer your question,
Yes,
Greg?
thanks.
Okay. Are you okay with proceeding in this way, Ms. Pimentel?
Sure.
All right, let's, I know a big goal overall for some time for a number of people has been on the Board of Health, has been outreach to other boards in the health department and other committees in the community at large. This is a very big and very long-term goal, which would have to play out in a multitude of ways. I'm glad that we're thinking of it as a general goal. Certainly, meeting with the school committee to ensure close communications during the upcoming 22-23 school year, specifically focused around COVID, but around other issues as needed, is something we'd like to see happen, and collaborate with the school district to assist in planning for the safe opening for the 22-23, which overlaps word for word with the health department's goal. It is, as always, a challenge for a board of 3, because we can never communicate about things which we might eventually need to deliberate about. So I just want to give you a heads up that yes, I have been in communication with the superintendent and with the chair of the school committee, with Jen and with Murphy and with the school nurse about a possible preliminary meeting this summer, in which just a small group of us would begin to explore the upcoming school year And once that conversation takes place, then we would move to the next level, which could potentially be a meeting between the entire Board of Health and the entire school committee. But we would start small and build. Just want to let you know that. And then these two things here could be deleted because they are redundant with what I just said, which is incorporated in number 1 there. Any comments from my colleagues regarding what you'd like to see out? And this does not preclude outreach to the Council on Aging and all of the other groups that we have talked about. So I'm just mentioning that for starters there.
Looks good.
Okay. Okay. I will say that a member of the select board has reached out to me. We are starting a conversation regarding some specific recommendations that he has for various potential programming for youth mental health. So with Maureen and Greg as the point people, as soon as I have more information, I will send that your way from the select board member. On DEI, diversity, equity, and inclusion concerns as they relate to health, that should be all of us, I think. And we did last meeting endorse a women's reproductive health services statement. I don't know if anyone would like to take the lead on women's reproductive health services or any other issues. In my opinion, what needs to be done here is to identify some of the available resources and to make those available to the health department and on our website to support that statement. I would say that's a long-term project. It's going to take a bit of work. Would either of my colleagues want to be a point person on women's reproductive health services?
Sure.
That would be great. That would be great. Thank you, Maureen. And I will send you whatever I turn up. I will note that the Pride Fest from the high school, they are holding this Pride Fest on the Common on Wednesday. It's from 5 to 7 p.m. And whoops, hang on here. It's 6-8 in the town common, 5 to 7. In the past, I know that Ms. Butler has attended and actually walked around and given resources, literature to people or talked with them about the resources available through the coalition. I am going to attend from 5 to 7. I would love it if other people could also attend. I know, Dot, you're not able to be, could you tell us a little bit about what you've done in the past? And I understand you cannot be there this year. Is that correct?
Correct. Unfortunately, I'm going to see Paul McCartney, so I have tickets for that instead.
Oh my goodness.
That's a good excuse, Doc.
Thank you. No, I mean, this is relatively new. I think Leora and in her leadership for the for Network for Social Justice, it's really I want to say student driven, which is really important. And she does have significant people that will speak, adults that will speak, and youth that will speak as well. Last year, I thought it was only for an hour. We raised the fund,
yeah,
really important, and had some challenges with the pride flag. That sometimes it's there and sometimes it's not. We never know exactly where it ends up. But of recent, I think we have it. And unfortunately, where the flag does fly in the common is not as noticeable, but it is there as well. There's a craft table to bring the youth together, and different leaders of the different clubs at the high school that share what they've been doing.
Yeah, I mean, Ruth, I'll be there too.
right.
And I've been in touch with the organizers and planners.
Right.
This year, there definitely are. There's a thought sort of moving forward to make, have it. It was definitely grassroots, led by middle school and high school groups. But I think having town officials and town groups get involved and engaged and working with these over time, I think will make sense. I think it also does overlap a lot with some of the mental health concerns that we are dealing with. I mean, when we heard the report on the youth risk behavior survey, there was obviously disproportionate challenges among the LGBTQ youth in town, and that's certainly not unknown to others. And so I think today, this year, given that it's in 2 days, is really a listening exercise for those of us to say, what are we doing? What are we learning? What are we hearing from them and the community? What do they want? And then I think there's going to be, there's more of a group of people that are working with the Network for Social Justice to sort of think about how to sustain and I think thinking about how the Board of Health and the Health Department might interact with them in the future, including work with the coalition. I know, Dot, you have some ideas. I think honestly for this year, rather than being an official presence, it's more about us being there, supporting the situation, and thinking about how that we might want to work with the groups moving forward.
That's well put, because that's basically what I did when I attended. And I've worked with the Spectrum group at the high school to some degree and so forth. And it's all a learning curve. It's a process that we have to bring a lot more forward to our community than just one day. I wish it was not the month of June. I wish it was the month of September or October, where we could really launch some things. We kind of do it, and then we go to summer mode, and then we come back with school.
Well, I'll hold you to it. Let's do it. Let's work.
Okay, I already told you what I would like to do, but yeah, it's definitely. I mean, we had select board people there last year. We had town manager. Yeah,
I think it's important. I think it's important
to know is that on June 15th, and they've done it for a few years, minus COVID or whatever, but Parent to Parent also holds a program at the library in the evening, 7 o'clock, alphabet soup. And again, speakers, it is very, that's very well attended. And again, a whole learning thing. There's a whole learning process that goes on with this. I think I told you for one of the coalition meetings, I had a gentleman come and just talk about the language that's out there that so many of us in the community don't even understand how to represent. So, yeah, I think that's one of the main roles. Jen and I are working on a wellness directory resource guide, and it have dedicated a number of resources that will be available to the community once we finalize it. So, but
That sounds good, and thank you for that background and update.
But I think your idea of walking around, being present, showing support, that's major. We got to, the crowd that was there last year was amazing. We got to triple it. And
but everyone knows you, and I'm wondering whether I should, or potentially Greg should have on a name tag identifying us as Board of Health members.
Well, there were a lot of Greg's friends there. I met a lot of Greg's friends last time. And,
I think it's a good place to start, to just be there and talk to people. I think that's perfect. And I think that, I think more broadly, I think it's important for us to keep, I think this does intersect a lot with some of the other mental health work that's being done. So I think it's in the right space.
Yeah.
Very good.
It's worthwhile. Definitely go. And hopefully the weather will be okay.
Yeah, it should be a little bit rainy on Wednesday, but we'll see how we do there. All right, that sounds good. Maureen, were you going to do some kind of discussion or a presentation today on mental health?
No, so I talked to Jen and I talked to Dot, and I think that right now there's a lot of things in the works with the resource guide. Dot's putting put a support group together, and there's some other things sort of going on in the background. So I think that we should sort of regroup on this, and then we can talk about it sort of more fully when everything's sort of ready to roll.
That sounds great.
I agree, Maureen. I mean, it's the next on our agenda item is to sort of talk through that. And I think we've already alluded to sort of how we think that there's a lot of things going on. I think the big question for me, and I think something we can explore is, are there things in the town budget that we need to be thinking about, either advocating for, requesting for funds, thinking about, there's one thing about programs, but there's other things about resources. And I think that's where, again, these discussions, I think we can advocate for all these wellness resources, and that's great, right? But ultimately, if and this is where the dialogues come with the school or the select board to say, if there is an identified need that then requires some financial backing, then, we've talked about funding streams that are available, whether they be, you know, ARPA funds or other funds, you know, whether we need to go to town meeting for funds, whether we, I think that's the bottom line, is that like,
Yeah.
we can come up with all this information, but if ultimately, you know, I'm just going to throw it out there, like if there's saying, you know, we want another resource specialist in the school system, you know, we need to work with school committee to say, you know, that we as a board of health think that's an important thing, let's advocate for it. I think those are the kind of things that I think our work can lead to, because ultimately, you know, a lot of these kinds of programmatic developments just require money, and the coalition is lucky to have grant funding, but you know, there are other things that require other types of funding. And so I think we're all on the same page and understanding that that's what we can advocate for.
If
I
could
also just think
share a
one
few-
other thing is, I think the one biggest thing that I'm getting a lot of calls and information about is access to care. And when people are in crisis, when you've never had a mental health crisis, you've never had a child who's had a mental health crisis, it's not, for a lot of people, they don't even understand that, you could, you know, call your pediatrician to start, or there's mobile crisis units. So I do think that us getting messaging out there about how to deal with a mental health crisis, what the access points are, how to get yourself into care, and also, you know, resources that are out there. And I know access to care is the biggest problem right now, is we have less providers than we do people who need help. And I don't know if there's some funding that can go to that. I don't know if, you know, offering discounted online apps or therapy. I mean, I don't know what the right answer is, but I do think that getting some messaging out there about accessing care and how to access care is an important message for us to be getting out there.
Well, I totally agree. And this is a place where, you know, I think we can, and Ruth, you've already been in communication with the Winchester Hospital folks. I mean, I think just even thinking about what their local resources are and publicizing that in some way, as, you know, and I think it'll be important. So I think all these things, you know, there's not necessarily policies, but there are things that we can be. I think it gets back to sort of the website, gets back to all the things you've already talked about, what we can, what kind of information we can have there out publicly as sort of a steward of trying to improve the mental health resources and access in the community. I think access, you're right, Maureen, is totally a big.
If I could just share one thing, at the beginning of COVID, when we were in such crisis and so forth, the town manager, Lisa Wong at the time, and the president of the Chamber of Commerce, Greg Bob, we had monthly, if not, sometimes it was bi-weekly or monthly calls with state reps and so forth.
Yeah.
And some of this stuff, even though we were concerned about the businesses and what was going on in our center, some of it came back to mental health. And Mike Day, I have to say, is a huge cheerleader for mental health. And in the House, you know, fighting for all kinds of bills and monies and so forth. So he definitely is a resource, something we can capitalize on and go to him. And also Jen and I participate at a community, I forget the name of what's the name of the committee, Jen, that with the hospital?
Community benefits.
But we've done that for a number of years, and we meet monthly with them. And there's people from, you know, all around the region, but we talk about a lot of these issues and monies. I have applied for little grants and so forth, and Jen has too, and they've been very willing to work with us. So, you know, that's led by Jane Walsh, who is president of North Mark. She is the chair, but Rick Weiner and a number of different people, food pantry, some representatives from schools and the hospital representatives and so forth are on that committee as well. So some of the things are being done behind the scenes, like we keep talking about behind the scenes, but bringing you up to speed as to some of those meetings and so forth is really important.
Thank you, Da. And I did hear a bit about those conversations. And at one point in time, Jason Lewis said to me that if the town manager, Beth now, would like to continue those, he would be happy to do that, and would, if Beth would like that to happen, would welcome the Board of Health to the conversation.
Well, Jen used to come all the time too, yeah.
Yeah, what is the status of that? And is there a?
They stopped for a few months. As far as I know, there's going to be another one in June. It's going to be reassessed, and you know, maybe not as frequently, but definitely continue them, because different people came on the calls for different reasons. I would like to say Jason Lewis was there. I have to give kudos to Mike Day's attendance.
Yeah.
Lewis, unfortunately, Jason Lewis always sent a representative, so I don't know if the messaging always carried back.
Yep.
I don't always, I'm blunt, I don't always feel Winchester is high priority for Jason Lewis. I don't hold back, you know, which frustrates a bit, you know, when I get up every morning at 8 o'clock, listen, you know, on the calls and participating and so forth. But I think if you have contact with him, Ruth, go for it, because he really should be hearing about what the needs of Winchester as opposed to Malden are. As well as Walden, I shouldn't say as opposed, as well as Walden.
Let me place a call or reach out to Beth and see, because she is really the person who would coordinate this and.
Well, it
host that.
was a partnership. She doesn't always want the responsibility. So it was a partnership between the chamber and Beth did when Lisa Wong left, Beth did participate. I will say that. But,
Okay,
yeah. But it was,
I do think some behind the, not behind the scene, but prior to getting to that level of Jason, we sort of.
Yes, yeah.
And figure out and hone what exactly our ask potentially is.
Yeah.
Right. So I think to the
Yeah, I
extent
agree.
that we can really streamline this, because I think it's helpful to that we don't just come and, say, well, we have a problem and you go fix it. We need to
Right.
really pinpoint exactly what do we need? What's the ask? So that
Yeah.
we should work on as a town collectively
Right.
first.
No, I agree, Jen, completely, 100%.
yeah.
do you want me to leave that in your hands, Jen, or shall I have an initial conversation with with Beth and see what she might have in mind, or is there a given
Yeah.
process? Yeah. All right. I'll make an initial outreach but I'll work closely with you and let you know what's going on. We'll see if we can get a little more collaboration. I also want to just mention to my colleagues that in a recent select board meeting, they did note that there were ARPA funds still, Jen or Diane, so I think it's about 2 million. And I have reached out to Beth with my other hat in climate, and they are, there's a limited pot and there's a lot of asks, but they recently okayed 2 new ones, but that still left them with a significant chunk of money. There is an Excel spreadsheet. There is no limit to the number of asks that can be put on that Excel spreadsheet. So we are in discussion regarding possibly putting an ask from the climate lens, and it overlaps with health regarding money for heat issues, some of the issues that were brought forward by Mr. Pruitt, and those had to do with splash parks for kids and with but if there is a need, and Maureen addressed this during the meeting, as I recall, for any additional or replacement heat structures, those basic just tents on poles. So a lot of conversation needs to happen still with the DPW, with Nick, and with others to assess the state of that. And that may or may not then go to Beth, who told me she doesn't have a deadline on putting that in an Excel spreadsheet, but it might be worth putting something in there, which then goes to the select board for consideration. Even if it doesn't get funded right away, it continues to raise the profile about perceived needs from the Board of
Sure.
Health.
I mean, but I think that gets back, Ruth, to what Jen was saying, is that there needs to be a specific ask. Just saying we think there should be money for mental health, it's not going to go anywhere. So I think
Well,
it's
I wanted
about,
to ask Jen if there are asks that you already have for those $2 million of ARPA funds, or some that you have in abeyance. And I agree with you, Greg, we don't want to just say we need mental health. But, and that's why the other 2 from the climate lens are very specific, which may or may not go forward. More research needs to be done with that. But do we want, Jen, I think I need help from you on this. Do we want
Sure,
to
yeah.
ask for any?
Any more?
I'm asking you if you have, is the health department one of the lines on the select board's Excel spreadsheet for the remaining ARPA funds? Or do you have things you'd like to fund that you'd like to bring forward and put on their Excel spreadsheet? And we could say, yes, the Board of Health supports you in that, or whatever.
Yeah, I think we have 1 million, or we had a total of $1 million set aside because we were trying to think about, COVID in the future, which is a little tricky to do, but
Mhm.
I believe up to 1 million has been reserved for that particular topic. But in terms of other we received the $35,000 for the mental health emergency funding to specifically around a project I've been working on with NAMI. And So we could perhaps expand on that. We can think to the next school year, Dot, how we want to tackle that. And if there are any holes that the ARPA funding can fill, maybe we can go back and make a request for that. But yeah, let's have a discussion, Dot, you and I, about that. Don't worry, I'm not shy about asking for more. So,
And I knew that you would be well aware that there's a balance left in the ARPA funds, but
there is, and we also haven't spent all of the COVID funding, but I do have to reallocate. The original ask did not include vaccination clinics because FEMA was picking that up and reimbursing us, but that
right.
has largely stopped. So I do need to have them redefine or broaden the scope of what I can spend that COVID money on to include vax clinics.
Great.
With that, should we move on to the next issue, which is the director's update? I know you might have to leave a bit early. Is there, you want to jump into that, Jen?
Yeah, sure. Just really quickly, I want to highlight that we have a clinic stood up for 5 to 11-year-old boosters. It'll be on June 14th, and it's on our website. I can pull it up right here. You can register right online. We did send notice out to the schools today that hopefully they have pushed out at some point or will push out this evening.
What's the hours?
Yep. So sorry. Can you see that? Yeah. So 4:30 to 6:30 at the high school. So after working hours, parents, hopefully it'll be convenient for all. I wanted to catch people before the school got out and everyone left for the summer. So this will be for the Pfizer booster, June 14th, 4:30 to 6:30.
Great.
That's
And,
great.
okay.
And we already have registered 3% as being boosted in that age category in Winchester. So people, it's well underway. The effort's underway.
That sounds like an opportunity for more.
Oh,
You said,
absolutely.
yeah, you said 3% of that age group are only 3. Is that what you said? 3%?
Boosters.
3%. I'm
boosters.
just saying people are at least taking advantage of it, right? You can see
Yeah.
it show up.
Yes.
It's only been 2 weeks, so
Yeah,
that's
you know,
true.
Just new.
Yeah. Very good.
And we have received the okay. We can start place an order for under 5 group as well. You know, not that anyone's ready to go forward with that, obviously, but we are allowed to pre-order for that as well. That's something that we have to weigh carefully given that age group. I would almost prefer that, you know, the primary care physicians handle that in the office, given, you know, how small and
Yeah.
you know, it might be a more comfortable setting for folks, but again, I don't want anyone to miss the opportunity. So if we did it, I wouldn't hesitate to have our best nurses there.
Great. That sounds great. All right. We need to move on to, the COVID update. So I remind the board members that the town meeting mask mandate reads, if no action is taken by the Board of Health to rescind it, this regulation will remain in effect throughout the duration of the spring town meeting. And we voted to extend the mandate to the special town meeting, which is tonight. My glancing at the various data is that it continues to bounce around but remain high, and I would not suggest that we make any change in that. How about my colleagues?
Well, we already sent a letter saying we weren't. I don't think there's anything to do.
Correct.
Okay, great. All right, so the minutes of 5:23, did you folks have an opportunity to look at those?
Yep.
Is there a motion?
I move to approve the minutes of 5:23.
Second.
All in favor, Dr. Sawicki,
Aye.
Ms. Pimental,
Aye.
and Ruth Tramarki says aye. That's done. Is there anything else that anyone would like to bring forward under old or new business? All right, then let's call this to a close. Is there a motion to adjourn?
Motion to adjourn.
A second.
And me as well. So Ruth Tramarki votes to adjourn. The meeting is adjourned. I'll see some of you at town meeting
Have fun
tonight.
at town meeting, guys.
Oh, man. It's
Do
gonna
we
be
have
a lot of
another
fun.
meeting for this on the books or no?
Oh, that's right.
For town meeting?
No,
Another,
for us.
For us.
well, we normally meet the second and fourth Mondays. And unfortunately for us, this is the first Monday. I did check with Jen as to whether or not we could maybe eliminate tonight's meeting, but because we couldn't, we went ahead, we had to meet in terms of the town meeting issue, and we went ahead and invited Ms. Busby. So we are scheduled at some point, I think we all agreed that we wanted to move to monthly
I think that's
instead of
fair.
weekly. I don't know which month you had in mind. I would suggest we meet, I don't know, what do you guys want to do?
I think
Yeah,
if
I'm
we
sure.
can, we can move to monthly, and if something comes up, I think that we move
I
back
agree.
to something.
I missed the word that you said, Maureen. Did you say this month or next month to move?
Yeah, why don't we just meet the first week? Well, the first Monday of July is July 4th, so we can't meet then. But well, I'm sorry.
And I'll be on vacation on July 11th, so
Do we
So,
want to meet the fourth Monday of this month?
I'll be away then too. I have like sort
Okay.
of a end of June, early July vacation. So, I mean, I think unless, it doesn't sound like we're
We
gonna have
can
anything.
change we don't have, doesn't have to be the second or the fourth. We could meet, as long as we post it, we can meet on another. Monday seems to be best for Jen, but what do you guys?
No, I think Monday
Renee?
totally makes sense. The question is,
Okay.
I mean, I'm Maureen and Ruth, you probably are also taking vacations this summer, so we probably should just make, figure out
I'd
when
just
all
like to
those,
state that I had to call in from St. John, so your vacation comment.
well,
I'm
I
just,
understand,
I'm
Maureen.
totally joking. I'm totally
Where I'm
joking.
gonna, actually on the
Um,
11th, I'll be on a plane flying back from France, so there won't
No,
be any.
I'm kidding.
calling
It
me.
was a total joke. Right, so is the 18th, I guess if things are calm, July 18th is fine. If things are not calm, we would have to pick a date to meet before
Yeah,
that.
why don't, do you want to just say that we have a meeting July 18th and then?
That works for me. That's in
And then,
between.
If something comes up that we need to
Yeah.
meet on an
Yeah.
off day, we can do that.
that sounds good.
Let's do that. July 18th at 4:30 it is, unless something comes up before then.
Yeah, and yes, 4:30, okay.
Unless you need a different time.
No, I should, I'm just trying to see if I'm in the hospital that week. No, I should be fine on that day. That's fine.
Okay.
All right,
We'll
great.
communicate that. Thank you.
Thanks, guys.
All right.